that's a very controversial kind of Trump drug that they've come out. There were initially a bunch of studies that said it worked, and then the powers that be came out with some other studies that said it didn't work. But there are many, many studies and many doctors who I've talked to personally that on the front lines that use it all the time and it works. The problem with it is the powers that be, like the FDA, are trying to shut doctors down from using hydroxychloroquine. We know it works. Again, you have to use very early. The studies that said it didn't work, they were hospitalized patients that were very sick. So some of the studies are observational, but if you read the literature, even the Lancet and the New England Journal of Medicine had to retract their articles downplaying the use of hydroxychloroquine. And it's odd that a physician such as me, a board-certified family physician, the other day I tried to call a Z-Pack in for one of my patients who had bronchitis, and the pharmacist asked me if I was using that for COVID-19. I found that odd because why would they question what I was using it for in the first place? I'm telling you, the powers that be are trying to control what physicians do. There's no time for that. There's an art to medicine as well as a science, and you don't need a double-blind, placebo-controlled trial to know that certain things work. You have two ends, one, should you treat with some of these medicines we know probably work? We know work because we're using them, but we don't have the studies yet. It's become so politicized that the FDA, Dr. Fauci, they want a double-blind, placebo-controlled trial on everything that is recommended. Unfortunately, we don't have the time to do a double-blind, placebo-controlled trial. So you have to use common sense, talk to other doctors who are doing it. I know a lot of frontline doctors, friends of mine, that have gone to New York City. They're getting ready to go to Florida. And they use this routinely as a prophylactic themselves to prevent catching the virus. So, and it's been kind of maligned as a drug, but hydroxychloroquine, which we used to treat malaria for 50 years, it's dirt cheap. You can get it over the counter in Africa. It has, and we also use it for lupus and rheumatoid arthritis. We've used this medicine for many, many years. They're claiming that it may cause a cardiac arrhythmia, which is rare as hen's teeth. I've never seen that. I've talked to rheumatologists who use it daily for decades. They've never seen it. So it's kind of become politicized. But the truth is, there's many, many studies. There's a Yale epidemiologist. You can look at his stuff on it. There's a professor at UCLA out of Harvard that uses it on his patients, and it really does work, in my opinion, if you use it early. Not for everybody, but in this world that we have, we know so much more about how to treat COVID-19, and the mass media is portraying this as like a death sentence, so they have everybody scared, thinking there's no treatment. You can just end up at the hospital and die on a ventilator. That could be further from the truth. The truth is that the incidence rates are going up, especially in Tennessee where I am, but the death rates are plummeting because we know more about early treatment and things you can do in the hospital. If you really do get sick, there's other things we can do like convalescent plasma, remdesivir, IV vitamin C, things like that. So I'm encouraged. I don't think we're losing this battle of COVID-19 like the mass media is portraying it. In fact, I think we're winning it, or we're going to win it. People do need to do those things like social distance, probably wear masks, and not go to large events, take your vitamins for sure, especially the vulnerable population. If you look at who's really having problems with COVID-19 and dying of it, obesity comes out number one for me in my research and observation. Diabetics, hypertensives. I am a Christian, and my faith really carries me through every day, caring for people for all these years. And there's a couple things I'll tell you. One is there's another very powerful thing that works against any disease or illness, and it's called prayer.